My name is Tiffany Holt. I'm a nurse practitioner student with East Tennessee State University, and I'm here to talk to you today about gestational diabetes. Now, gestational diabetes, it's the most common metabolic disease during pregnancy. Normally, a woman's body will increase her insulin secretion to compensate for the 50% decrease in the body's glucose disposal process. When she develops gestational diabetes, her body it doesn't produce enough insulin to compensate, thus making her temporarily diabetic. The main problem with this is the fact that insulin cannot cross the placenta. Therefore, when her blood sugar is uncontrolled, all of the excess is given to the baby, causing problems like macrosomia, which is a larger than normal baby, which can lead to complications with delivery. It can cause respiratory issues and hypoglycemic issues for the baby once he's born. So, I present to you today with 5 cardinal rules to make gestational diabetes your you-know-what. Number 1, it's most likely not your fault. There are manageable risk factors such as obesity and a poor diet. However, a lot of women end up with gestational diabetes because of their ethnicity or family history, not necessarily the time to thank what your mama gave you. Regardless, the important thing to know is don't dwell on the fact that you got GDM. Even if your lifestyle caused it to occur, that's not what's important now. What's important is that this detour in your pregnancy journey can just be a tiny little bump in the road. If you eat what you're supposed to eat, watch your blood sugar, and do what your provider instructs you to do, there is not a single reason that you and your precious little one can't be just fine. Number 2. You might want to just go ahead and get used to needles. I know as providers, we like to act like it's no big deal to stab yourself with a tiny needle 4 times a day. Just know, unfortunately, there's really not any way around it. It's for you and for your sweet baby, for your safety, and honestly, after about a week, your fingers get pretty used to it. Just rotate the finger, and I recommend going for the sides of your fingers. There's less nerve endings there, and you don't use the sides of your fingers as often as you use the pads. Number 3. Watch your diet and say it with me. Protein, 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 protein. Gestational diabetes, it's a lot like regular diabetes in that a low carbohydrate diet with a strong push on protein is the way to go. It's not like regular diabetes in that sometimes there is no rhyme or reason as to why your blood sugar responds to certain foods the way that it does. You may find that licking a pineapple shoots your blood sugar up like you just ate a Twinkie. You may also find that eating a side of roasted potatoes with steak doesn't elevate it one bit. I know I mentioned protein, but protein is the way to go. If you're eating something that has some carbs in it, limit the amount you eat and pair it with a good source of protein, and most likely your body won't betray you with a 200 plus blood sugar. Number 4, cravings do not have to be the enemy. You just have to recognize that you can't head straight to Chick-fil-A every time you're craving waffle fries. It's not going to be the best idea. It takes a little bit of planning and a dash of patience, but if you're craving something like pizza, for instance, or mashed potatoes, cauliflower, while in my opinion is pretty disgusting by itself, can do some pretty magical things when you mix it with some eggs and cheese, I'm telling you. Go onto Pinterest and look up low carb ... whatever it is that you're craving, and I can almost promise you that something doable is going to pop up. If something happens and you're just weak one day and you give in to that craving, don't freak out when your blood sugar spikes. Just drink some water, take a walk, hop back on the low-carb train. A rise in your blood sugar once or twice isn't going to harm your baby. It's repeated lack of blood sugar control is when it becomes harmful. And number 5, you might end up needing medicine, and it's important to know that that's okay. Sometimes, no matter your best efforts, diet and exercise alone just isn't going to cut it, and that is when medication can come into play. There are a few options. There's glyburide or metformin, which are pills that you can take daily to control your blood sugar, and there's also insulin, which is an injection. If it comes to that, you can discuss with your provider which option works best for you. Also, a friendly reminder, medication only works when you take it the way you're supposed to. So stick to these 5 cardinal rules, and you're going to be just fine. And at the end of the day, you're going to be happy and healthy, and you're probably going to feel a lot better than you might have beforehand when you're really taking care of your body. And you get to hold that sweet baby soon, so take your time, enjoy yourself, and pregnancy can be awesome when you let it.